Okay, we're going to go ahead and just jump right in. This is pretty easy to understand. So if you're jumping in a minute or two late, feel free to pop something in the chat button, but you should be able to follow along pretty easily. Today you've got me, Betsy Schneider, and my husband Lance, and we're going to be talking about a great MEC and MVP plan that you don't have to hide anymore. You can be proud to offer it. So we're super excited to have you here. A little bit about us. Between the two of us, we've been in the industry for about 30 years now. Most of that is on Lance's side. He was actually one of the pioneers that helped make the first MEC plans back in 2012, I believe is what he told me. So somebody who knows a whole lot about what MEC plans are out there now, what they used to look like, and everything in between. So really great knowledge on the backside here. We specialize in alternative healthcare space. So this is really the realm that we exist in. We do voluntary benefits and other things. So this is really what we specialize in and what we like to know and push out to our clients and brokers. So I'm going to hand it over to Lance here for a second.
So I want to kind of dig into, MEC plans are still big and they're obviously still gaining steam as well as MVP plans, but I really want to talk about why they're so popular and what has changed about them and what is different about our programs versus the other programs that you find out in the marketplace. And really, if we go back to 2004, we had limited medical plans or mini med plans that were indemnity products that paid $50 a day to go to the doctor, $75 for an emergency room visit, $500 for an accident, $100 a day for hospitalization. And they were indemnity products. They indemnified the doctor or the hospital. You used an ID card. They had a PPO network, but they were designed really for hourly, part-time, and lower wage groups that couldn't afford traditional health insurance and were looking for a solution for their employees to help attract and retain and give them coverage for everyday expenses like the ones we just talked about. And those products were offered and they didn't need to be compliant. But what happened around 2012 is we had ACA. The fact was we had to have compliant coverage, in these large employers, in these staffing industries, in these home healthcare companies, in these restaurants and hospitality industries that couldn't afford to offer health insurance were now faced with the fact that they had thousands of people, in many cases, that they had to provide ACA compliant coverage for, which gave birth to minimum essential coverage programs or MEC plans that could be combined with limited medical plans that would pay for all of your wellness services, pap tests, mammograms, checkups, physical exams, and they would make sure that those things were covered and would meet what the government considered minimum essential coverage and help the employer avoid the penalties associated with ACA. And that's the long and short of it. They were cost-effective solutions. They were around $60 a month, and they kept employees from wanting traditional minimum value plans. The second part of ACA was you had to offer affordable minimum value coverage plans that met minimum value, which were traditional, typically high deductible, or what we call ugly health plans that had the highest out-of-pocket expenses, the highest co-insurance that they possibly could. And employers offered that in order to discourage people from participating in those MVP plans and to encourage them into the less expensive minimum essential coverage programs. But today, we're in a situation where we have a whole different need. The ACA challenges have kind of subsided. They are still there. Employers need to make sure they're still complying by them, especially large employers, but we have small employers and startup employers and all types of companies today that have realized that health insurance next to pay is the most important thing that employees want in order to attract and retain key employees. And while we're paying more, while we're recruiting harder, while we're trying to create better work environments for our employees, benefits are something that we have to continue to offer to continue to attract and retain quality people. We've got a great way to do that, but offering coverage that is kept up with today's times and offering minimum essential coverage and minimum value programs that are actually going to deliver value, as the old programs really just haven't kept up with the increased cost in healthcare. A $50 benefit for going to a doctor when a doctor visit is $300 doesn't go very far. And we want to talk about how our programs today really help those employers that we're talking about, as well as other employers, offer valuable benefits that employees are going to see a need for without breaking the bank at the employer level.
So like Lance said, this is super important to have these employers have something that is not going to break the bank, that's going to retain those employees, that's going to do everything that it needs to do. But most importantly, it needs to be easy, or you're never going to get anybody to do it. So our plans are so easy. There's only 2 lives required. I think most of you will probably agree with me that you have not heard of that, or very close to that. So that is an awesome thing that we can offer to these groups down to 2 lives. So like Lance said, those startups, those smaller companies that aren't 1,000 lives, they now have options. They don't have to go out and try to find something else that's going to be cost prohibitive. There's no underwriting. This is huge. That means that there's no what's the word I'm looking for?
Medical underwriting.
Medical underwriting, nothing like that. No pre-existing conditions, nothing like that. The other great thing about this is there's no employer contribution required. A lot of our employers do choose to contribute because they want to help their employees. But the great thing about this is you don't have to. So if you are that startup or that small company where every dollar counts, you don't have to do this to find great employees and retain them. The other great thing is we have 8 plans. So we have something that starts all the way about $100 premium all the way up. So you can have something that's available to everybody on your staff and what they're looking for. The provider network is huge. You have over 680,000 providers, and that's growing daily. The other huge thing about this, and Lance touched on a little bit, is this is a no deductible plan. So there's no deductibles that have to be met before you're getting your benefits. The co-insurance does not exist either. You're simply paying co-pays. So that is how this works. So an example here is our MEC 4 plan. We have a MEC 1, 2, and 3 as well, but this is a little bit more meaty of our MEC 4 plan. So we wanted to kind of dive in and show you what these actually covered. So you're looking at a $25 copay for those office visits, a $50 copay for specialists, and $50 for urgent care and x-rays and labs. And you can see in those parentheses, that's how many visits that you get. So on that MEC plan, you get 4 visits per person on that plan to go to your regular doctor. You get 4 specialist visits, 3 urgent cares, and 3 x-rays and labs. And then you can go down a little more. You start getting some outpatient diagnostic testing and some outpatient surgery benefits as well. And all of our plans, the wellness care is always free. So the mammograms, pap tests, physicals, all that great stuff, that's always free. Telemedicine, which is really became the most popular way to visit your doctor when you just have the sniffles, instead of going in and getting that normal routine care, you're just calling them on your phone or you're video chatting with them. So this makes it super simple to get that antibiotic you need for an ear infection or something like that. $5 generic drugs. This is, really fantastic. If you're taking those generic drugs, it's only a $5 copay, nothing else.
Yeah, and what's really nice about these programs, guys, again, is these are not indemnity benefits. So if the doctor visit is $200, $300, doesn't matter. It's a $25 copay as long as you're using a network provider. Same thing with a specialist, same thing with urgent care, your diagnostic, your lab, everything is copay driven. So you don't have to worry about a deductible before things like an MRI are going to be covered. You're just going to have to pay a copay for that. And under the MEC plan, it's covering the most common services that you can imagine, as well as the free wellness and as well as free unlimited telemedicine, which is what the majority of people use. So it's just so much stronger than a lot of the MEC plans that you see that are out there.
So in addition to those MEC plans we talked about, we also talked about some of those MVP plans. We also have 4 MVP plans. I can't talk, try saying that fast 3 times. That offer additional benefits. So these MVP plans are when you're going to really start seeing those hospitalization things come into play. You're going to get some days in the hospital. You're going to get surgery benefits. You're going to get allergy services. You're going to get ambulance, and you're going to get other things like that. Stepping up to the higher MVP plans, you're going to get those additional visits and additional days in the hospital. That's the main difference. And anybody out there looking to have a baby for $400, this plan will do it. I know when I had a baby, it was quite expensive. So only having to pay $400 to have a baby is amazing. And then our ultimate plan is really our top of the line plan. Is about as close as you can get to a traditional major medical plan. You have unlimited, pretty much everything, unlimited visits, days of service. You also have radiation and chemotherapy if that's a benefit you hopefully will never need, but if you do, it's there. Dialysis is included, as well as branded prescriptions and so much more. These are just some of the highlights of some of these MVP plans. We have more in-depth sheets that we can show you, but great overall coverage.
Yep. So some of the biggest things we talk about on these plans are how they are copay based and they're not deductible based and they're not indemnity based programs. So to give you an idea of a traditional MEC and indemnity plan, you have a doctor visit at $300, $50 benefit paid. That's $250 that the employee would have as a responsibility. With our program, a doctor visit, even if it is a $300 charge, there's a $250 copay. There's no money remaining for the employee to pay. There is no responsibility as long as you're using a network provider. So they pay that copay and that is it. So again, as close to traditional insurance as you can get. But getting into our MVP plans that cover hospitalization and how these programs work under a typical MEC program, $8,000 charge, $1,500 hospital benefit, $1,000 daily hospital benefit, $2,500 total paid by the plan. The member would end up with $5,500 in expenses out of pocket. With our MEC plan, same $8,000 charge, $400 copay, $50 specialist copay for the anesthesiologist. The total the member would pay is $450 for the service with no remaining out-of-pocket expense. Everything else would be covered at 100% under the program for maternity. So that's how the programs are structured. Again, you wouldn't have to meet a big deductible. You don't have to worry about co-insurance. Everything is designed to be very simple and very easy to use. So with that, we'll go ahead and turn to our chat box. If you do have questions, please do keep yourself muted. Put your questions in the chat box. You can also reach out to us after the meeting, roundedbenefits.com or 614-546-8801. I'll leave that up for a second, give people a chance to put in questions, and then we'll check out the chat box. Okay, I don't see any questions as of this point. Nope, you can just put up what's the monthly cost and the different levels. So if you email me, Corey, that's definitely something that we can give you as far as a proposal of the plans. Our plans start out at $98 for our cheapest MEC plan a month, and they go up to about $500 for our highest level MVP plan. Those are individual rates. So the rates differ based on the programs that we have. How do you manage to have zero member responsibility as compared to traditional MEC plans? Well, everything is obviously benefit rated and actuary rated as well. Under traditional MEC plans, they are just paying an indemnity benefit. So again, going to the doctor, a $50 benefit. You also may only pay $50 or $60 a month for that program. That's only going to pay $50 when you go to the doctor. Our plans for our MEC plans, again, run anywhere from $98 a month up to around $240 a month. And again, they're going to pay just your copay is what the member is responsible for, and then we're going to pay 100%. So our plans function, they're not traditional plans, but they function a lot better or a lot more like a traditional health plan than an indemnity product would. Does it cover blood work 100%? And who's the network you guys use? And is this in every state? So yes, answering those backwards, the product is available in all 50 states. The rates are shelf rated in all 50 states. The network is PHCS that we utilize. And we do cover 100% for blood work. If it's wellness, it's covered at 100%. If it is not, if it is just a lab work, it's going to be a $50 copay. Who are our largest individuals and employer groups? Not something I'm going to share on the webinar as far as who our largest groups are. If you're interested in references, that's something I'd be happy to provide to you offline. We don't provide that information because all of our groups are generated by brokers, and that's typically who we're working through. But our groups range anywhere from 2 employees all the way up to thousands of employees. How about colonoscopies? A colonoscopy would be wellness related, which would be free under the minimum essential coverage, which is included in every one of our plans, all 8 levels of coverage, unless you are obviously having a colonoscopy because the doctor expects that something is wrong. That would apply then to the $350 copay. Good questions, guys. I'll leave it open for another minute or two, see if we have any other questions. And then the recording of this will be available as well as a presentation deck. If you're interested, just reach out to us. We'll be able to provide that for you. I'm going to go ahead and put my email address in here for you so you can reach me directly. We do have a TPA that manages claims for us. So there is a TPA that manages the claims on behalf of the insurance company. And commission rates vary by product as well. So it's something that we'll be happy to review with you between the MEC plans and the MVP plans. They vary, and that's something we'll be happy to go over with you. Okay, with that, guys, we're going to go ahead and close down the chat for today. My information is obviously provided. My email address is provided right there in the link. I'll put Betsy's in here as well.
And I know I reached out to some of you on LinkedIn as well, so feel free to just message me back on there if you have any questions as well. I'm pretty easily reachable for any questions that you guys might have.
All right, thanks so much, everybody, for joining in today. We appreciate your time.